Hello everybody! This is Dan Schumer. Welcome to Grand Rounds. I hope you're having a great Wednesday. I'm really sorry that I can't be there, but I wanted to share with you my advocacy project, the Vermont Diabetes Mentoring Project. So here at UVM, in our residency program, we use something called an individualized longitudinal curriculum model for resident advocacy education. Basically what this means is in our intern year, we try to figure out what it is that we're passionate about. We figure out how we're going to do that and actually do an intervention in second year or third year, and then we try to evaluate the effect of our intervention. We approach advocacy by first considering the child advocacy cycle of change. So really what this means is in order to advocate, first I must observe and listen to a population of kids that need our help. I need to engage by becoming an expert in an area where I want to make change, and there needs to be a way to evaluate if the advocacy effort that I'm making is making a difference. It was during my first year as a resident, I did an endocrine elective when I identified my advocacy platform. Type 1 diabetes is obviously a difficult disease, but care for children with type 1 diabetes has made such dramatic strides in the last 100 years. In 1922, Frederick Banting and Charles Best first used insulin to keep a dog alive after a pancreatectomy. Today we have sophisticated ways to use insulin in ways to keep our glycemic control in much better shape. Unfortunately, good glycemic control in type 1 diabetes is still a ton of work. Adolescents have especially tough times. They are being asked to take responsibility for important life choices, and adding type 1 diabetes into the mix can be a very difficult thing. So in the diabetes clinic, during my elective, we wondered if adolescents with type 1 diabetes were given mentors who were adults with type 1 diabetes, would that be helpful? So in order to engage this problem and advocate effectively, I needed to become an expert. I needed to specifically learn about mentoring and how an effective mentoring program could be created. In reviewing the literature about mentoring, first, I could find very little about diabetes specifically and mentoring, but there was a lot about mentoring in general, and it became clear that outcomes are better when mentoring programs are designed well. In order to maximize the effect of your intervention, you must follow some evidence-based best practices, which include things like appropriate screening of prospective mentors, thoughtfulness in matchmaking, providing mentor pre-match training, providing ongoing support and supervision of mentors, and also involving parents in the mentoring process. I now designed my platform. My platform became that I wanted to create a local mentoring program pairing adolescents with type 1 diabetes with adult mentors with the same disease in an effort to improve the health and quality of life in these young patients. So starting this mentoring program was not something I could do on my own. I needed to identify the other players in the community who would also want this to succeed. So first, the pediatric diabetes clinic is where the kids would come from. The adult diabetes program, the adult endocrine clinic, would be where the adults would come from. I talked to the adult providers, told them about what we were trying to do, and how they could help us by recruiting adults when they came to clinic. The most difficult part of this undertaking, I believed, would be the actual running of the program. Those best practice elements such as screening, training, matching, troubleshooting, I thought that was best performed by an organization who already had experience running a mentoring program. So I approached Spectrum Youth and Family Services, which ran a mentoring program already, and they were eager to help make this program part of their existing mentoring program. They would require funds to do this, however, and so I identified the Children's Miracle Network as a funding source and was able to obtain the funding to support Spectrum's participation. So with these collaborators in place, it was time to iron out the logistics. How would this program actually work? So basically, when teens aged 11 to 17 with type 1 diabetes living in Chittenden, Franklin, or Grand Isle counties would come to clinic, they would be asked to participate in the mentoring program if they were interested. Adult providers began recruiting adults with type 1 diabetes at their appointments as well. Any kid or adult that wanted to participate were then referred to Spectrum for screening, training, and matching. The matched pairs were expected to meet weekly for at least 1 hour, or on average 4 hours per month. The commitment was for at least 1 year. And they would basically decide together what community activities they wanted to do. Go out to lunch, go to a movie. We didn't necessarily expect that diabetes would be the focus of the interaction or the conversation, but that over time, the evolving trust between the mentee and the mentor would encourage conversation about the difficulties of diabetes in adolescents. In order to recruit participants, I also wanted to raise awareness about the program, so posters went up in pharmacies, in the adult and pediatric diabetes clinic, and in libraries around town. The Burlington Free Press got involved and ran a piece about one of the adolescents and her mentor, and then the local television news got involved and ran a nice story about a second mentor-mentee match. The next step in the advocacy cycle of change is to evaluate. So I wanted to know if what I was putting in place was working. First, could I even get the program off the ground? Would patients be interested in participating? Could we actually get adults to be mentors? Second, I wanted to hear from participants about how things were going. Did they like having a mentor? Did they think it was helping them? Did they want to stay in the program? Finally, how great would it be if we could actually measure that it was helping these kids' health? So, after reviewing the type 1 population at the clinic, we determined that there were 38 patients that lived in the 3 counties and were in the right age group, were available for participation. So all of these patients were asked if they wanted to participate, and 10 initially expressed some interest. In the end, 5 remained interested enough to go to Spectrum and get matched up. All of the kids that wanted to be matched in the end did get matched, and all 5 of the individuals matched completed the 1-year commitment. While I was hoping for more participants, I was encouraged that those who wished to participate were matched and remained committed for the 1 year of participation. I conducted one-on-one interviews with each participant after 6 months of being in the program. I asked each one if they liked the program, if they were enjoying themselves, and all 5 said yes. All 5 wanted to continue their mentoring relationship. Some things that I heard a lot were that it was nice to have someone to talk to about diabetes when they were having trouble. It was nice to see someone that was older and through adolescence with diabetes that was doing well. One girl said that when she was doing poorly with her diabetes, the mentor helped her get back on track. One really neat thing that happened, one of the mentors got really into having dinner parties at her house for all of the mentors and mentees. One boy said that he felt like there was a new little group of people with diabetes that were supporting each other, and I thought this was really great. We did track hemoglobin A1C as well, and the mean A1C for the 5 participants prior to the intervention was 9.1%. At the end of the intervention, after 1 year, the mean was 8.7%. While this wasn't statistically significant, I was excited that the trend seemed downward, and also that 4 of the 5 had improved A1C. A study with a larger sample size is needed to determine whether mentoring can have a positive impact on glycemic control. So I concluded that it takes a lot of planning and collaboration, but you can organize a mentoring program for adolescents with type 1 diabetes. From the interviews that I conducted, it seemed like people enjoyed being in the program and they felt like it was helping them. I couldn't say much about whether it was actually improving their A1Cs, but definitely further study would be required to determine this, and I think is something that would be great to do. So the next steps for me is to figure out how to make this program sustainable here in Vermont, and also how great would it be if I could share what we've done here with other institutions so we could increase enrollment and gather some meaningful data about A1Cs. This is why I was so excited to present this diabetes mentoring project at the PAS meeting a couple weeks ago. Also, it's clear that this is not solely a type 1 diabetes problem. There's lots of other chronic diseases where I think mentoring could be a neat idea. A special thanks to everyone who helped out with this project, and of course if there's any questions, feel free to email me, stop me in the hall when I get back in town. Thanks a lot.